coming to caloric test. This is called as Fitzgerald. Another name for this, exact name for this is Fitzgerald Hallpike Bithermal Caloric Test. और एक बंदा आ गया और इसको भी कुछ काम नहीं था, पानी से खेल के हमारे ऊपर एक टॉपिक डाल दिया. So bithermal caloric test. Bithermal caloric test. The name itself is telling you bithermal means they used water of different temperatures. Okay. So normal body temperature is approximately 37, isn't it? So you do -7 to that and you do +7 to that. Okay. So cold water, hot water. Okay. You have to remember a mnemonic called as cows here. Very important. This is mnemonic based. Whenever you instill cold water, opposite nystagmus will occur. Whenever you instill hot water, same side nystagmus will occur. Now, what is this nystagmus? Why do you want to pour cold water? Why do you want to pour hot water? Why do you want to see nystagmus? What is the connection between hot and cold water and nystagmus eye movements? आंख कैसे मूव होता है? कान के अंदर पानी डालने से आंख कैसे मूव हो रहा है? ENT को ऑफ तो को क्या लिंक है? Okay, देखो. Now there is a reflex called as vestibulo-ocular reflex. Vestibulo-ocular reflex. Okay. Vestibule. Where is the vestibule located there? From the vestibule towards the extraocular muscles. Okay. There is a nerve tracts present. Those are called as vestibulo-ocular tracts. Just like your vestibulospinal tracts, vestibulo-ocular tracts are there. Whenever I am moving my head towards this side, what is happening here? The fluid in the canals are turning towards that side. Due to inertia at rest, whenever I move my head towards right side, the fluid is flowing towards left side. You are sitting in a vehicle, the vehicle started and moved forward, you will be thrown backward. Inertia at rest. When I'm moving my head like this, the fluid is moving in this direction. So the fluid in this canal is moving in this direction, in this canal is moving in that direction. This side, whenever I move my head towards the right side, right vestibule will send excitatory impulses, left vestibule will send inhibitory impulses to the brain. And whenever I am moving my head, my eyes should also turn towards same side. So when I move my head towards, so suddenly if I move my head also, in the same speed, my eyes will also move with the same speed towards. So this vestibulo-ocular, the right vestibule is connected to right lateral rectus and left medial rectus. Whenever I am moving my head towards right side, these two muscles will act and they pull the eyeball towards right side. When I am moving towards left side, the left vestibule is connected to left lateral rectus and right medial rectus. So they will be pulled towards this side. If this vestibulo-ocular reflex is not functioning normally, if I move my head towards right side, my eyes will be lagging towards left side. If I move my head towards left side, my eyes will be lagging towards right side. You understood this? You understood this? Simple. Vestibule is connected to extraocular muscles. Whenever I am moving my head towards right side, eyeball should also move towards right side. See, you have gone to a forest. A lion has come and started chasing you. You have to run forward. You turn your head and run forward. If your eyes lag behind, you turn your head. So your eyes will be seeing towards one side, you will be running towards one side. No points. You can't run forward. Understood? So that sharp reflexive action should be there. The moment you turn your head, the eye should also move the same side you stood. So that is how. Okay. Your vestibule and ocular movements are connected. Now, whenever I pour the hot water or cold water. What this hot water and cold water is doing, I told you, whenever I am moving my head towards right side, my fluid endolymph is moving towards left side. So without moving the head, if I want to move the endolymph, how can I move? By pouring cold or hot water. So this temperature changes. When I pour the cold or hot water here, the temperature changes will change the density of the fluid and the fluid starts moving. Without moving my head, the temperature, if I change the temperature here, that will change the density of the fluid and that fluid will start moving towards or away. So depending on the movement, the nystagmus will occur. The eyeballs will move. So whenever I pour cold water, the nystagmus will be towards opposite side. So if I pour in the right ear cold water, the eyes will move towards left side. Left nystagmus, opposite nystagmus. Fast component towards left side, slow component towards right side. Fast component towards left side, slow component towards right side. Like this. Whenever I pour hot water in my right ear, same side nystagmus will be there. When I pour cold water, the fluid will move in this direction. When I move hot water, the fluid will move in that direction. Understood? Understood or not? Clear? So that's why, depending on the temperatures, movements of the water, opposite movements of the waters, opposite different sides nystagmus you will be getting. In the left ear, if I pour cold water, nystagmus will be towards right side, opposite side. In the left ear, if I pour hot water, nystagmus will be towards same side, left side. So cows, remembering the mnemonic cows is very important. So I take a patient, okay, like you and me, normal patient. I make him lie supine with a 30-degree head and elevation. The position here, what is the position of the patient? Supine with 30-degree head and elevated. Now, why this position, See, when I am lying horizontally, my horizontal semicircular canal, lateral semicircular canal, both are same. They are not exactly in the horizontal plane. Slightly 30 degrees they are present like this. In this plane it is present. 30 degrees like this, right? Not like this. Not exactly like this. थोड़ा सा 30 degrees में रहते हैं. Okay, in this plane. Now, see, when I make the patient lie supine, so in the supine position, to the vertical, the lateral canal is 30 degrees posterior. Now, when I make the head end elevated 30%, the lateral canal will become vertical. Okay. So, this is the horizontal plane. Your lateral canal is arranged in this way. Means 30 degrees like this. Understood? Now, if I Now, what happens? So this is your horizontal plane. Now the canal is present 30 degrees like this. Now, if I make the head and elevate 30, this is supine position, no? Now, if I make the supine with 30-degree head and elevation, okay. Now, what happens to the lateral canal? It comes to lie in this plane. So this is your horizontal plane. This is the plane of your semicircular canal. Understood? Now, what I am doing here in this position, the horizontal semicircular canal is becoming vertically oriented. Understood? Horizontal canal becomes vertical. Why you should make it vertical? Because due to gravity, the fluid movements will be faster. So you will get quicker response, better response. Understood? Okay. So that's how. So this cause phenomena is seen in normal person. So like you and me, I don't know about you, but me, if I do this caloric test on me, okay, I give hot water this side, okay, same side nystagmus. Cold water this side, opposite side nystagmus. I give hot water here, right? So warm water here, same side nystagmus. I give cold water here, opposite side nystagmus. If I am getting this response, that means that patient is normal. That patient is not a patient. Okay, he's a normal person. If I am not getting this normal response, if I am getting something abnormal response, different way of response, there is some pathology inside. Understood? Okay, clear?